Hello Monica, how are you?
Hello sir, I'm fine.
Okay,
Sir, I have a question, sir.
please.
How do we approach fever?
How do we approach fever? In what setting? In pre-op setting?
In pre-op setting, sir. For
Okay.
pre-op patients.
Like suppose some patient is waiting for surgery
to get operated.
and he develops fever. So as like I generally think 360 degree, and in that process, as I have mentioned you earlier also, that taking care of a patient is not only a doctor's responsibility, it is responsibility of the nurse, it is responsibility of the patient himself or herself, and responsibility of patient's relatives also. Okay, so in these three prongs, like patient prong, I have included the patient relatives also. In these three prongs, we are going to approach the fever. Okay.
So what do you think about patient psyche, sir? How they will feel about fever?
Okay, so the thing is that when patient is having fever, my like work I have done in metro as well as now I am working in the rural setting. So I am seeing a very stark difference in their psyche. Like suppose a patient is there in the metro, they would like to hyper investigate. They would like to see whether they have COVID, they have dengue, they have malaria. They will do umpteen number of tests. Okay. They will be searching on Google. They will have a diagnosis, potential diagnosis ready before even meeting a physician. And in rural setting, as I see, patients don't even report fever. And suppose if they have fever, they account it for weather change, or they account it for some food, or they account it in such a way that they ask for tablets and they want to just get away without doing proper workup.
What is middle part, sir?
Means in the sense I think that we have to bring these two extreme psyches into middle path, where a metro patient has to stop overthinking and a village patient has to take things a bit seriously. Okay, so nothing is in the extreme is good. We should not hyper investigate, but at the same time we should not discount some important possibilities of fever. For example, in rainy season, we should definitely think about the vector-borne diseases like malaria and dengue, and we should definitely investigate those things.
What is the approach of nurses towards fever?
Yeah, it's a very interesting question because many a number of times we see nurses delivering their drug without even asking doctors. So sometimes patient will tell I have fever, the nurse will give off one paracetamol. I have a humble request to all the nurses who will be watching this video. Please do inform to your duty doctor that patient had fever. One. Second thing is that your job is to take the thermometer and measure the fever and inform duty doctor that this is the fever.
How doctors to approach fever, sir, especially in pre-op patients?
Yeah, it's very, very important that we should not discount the possibility of patient having any infection. Okay, and it's very, very important for all of us that we look at the things holistically. If I am a neurosurgeon, I should not be thinking only about my brain tumor or spine tumor or spine condition. I should be thinking, okay, patient has fever, then I have to work it up. I have to evaluate with various blood investigations and I have to see whether patient has any infection. Okay, and in my experience of so many years, I have seen many a number of times just before surgery, patients will be diagnosed with dengue, where there is a risk of low platelet count. And low platelet count, if I operate in active dengue and patient develops low platelet count, it becomes a very interesting and very disastrous circumstance. Okay, so we have to be very, very careful about it. As doctors, we have to investigate. And as doctors, if we over investigate, nobody will tell anything. But if we investigate less, if we have missed something, then definitely we will be considered by the law that we have done the negligence. Okay, so always think about possibility of positive diagnosis and investigate. Not an issue. If it comes negative, good for the patient, good for us. But if it comes positive, then the whole course of action changes. Okay. Anything else, Monica?
Thank you, sir, for letting us know.
I have to thank Monica also, that Monica is very much enthusiastic about learning, and we think that we have to put material in such a way that we are helping people to improve their consciousness. So this video is targeted towards doctors, nurses and patients. This video is a combination, it's a 360-degree approach, and I request whoever is watching these videos, please share, so that the fund of knowledge, the overall fund of knowledge in our society improves, and we work in cooperative manner than combative manner, so that we have a better healthcare system. Better healthcare system does not necessarily come up with a better technology, it comes with a better approach. Okay, with that, thank you very much. Thank you, Monica.
Thank you, sir.
Have a nice day, everybody. Thank you.